Hi, everyone, and welcome to our podcast, The Naked Truth of Healthcare. Today is part 2 of our podcast with Professor Emeritus from York University, Dr. Patricia Bradley, talking about incivility and bullying in the healthcare workplace. Yes, it does happen. Our last podcast, Dr. Bradley took us on a little journey into how incivility rises and how it is experienced. Join us today.
So what skills do they have to help them to deal with it too? And well, I'm a student. Well, you still should not be experiencing sexually inappropriate behavior.
Right.
And that's common for nurses to, I experienced it as a student and I experienced it as a nurse, and I never reported it to anybody.
Um,
I didn't even report it to people I liked and trusted,
yeah.
so
Yeah. It's like there's this underlying conditioning that
yeah,
happened at some point where, but you're saying you see it right when people are being educated. You see examples of it. It's coming out. There seems to
yeah.
be conditioning of not to say something.
Hmm.
Why it's there, I couldn't
I
even
don't
have
know.
a guess.
And I think that's why there needs to be education and support when they're students and when people are in practice. And I think the get over it piece is not the right answer. Do you know?
Yeah.
Um, it isn't because if the statistics show that in response to experiencing incivility, there's insomnia, anxiety, physical GI symptom, like all kinds of results. How can you say get over it? It's having an effect mentally and physically
Right.
and to the organization
Right. And to
and the
the,
quality of care, right?
yeah. So I don't know. I'm gonna be a little provocative here and say this stuff is easy to ignore if you've got a person who's not reporting it and feels shame around reporting it and will pretty much keep it hidden for you. But you just said there's an impact to patient care.
Yeah, there is.
It's hard. It's like it's impossible. It's impossible that there isn't. I don't know. Common sense. I'm not a researcher. I'm not a scientist, but I'm telling you, common sense tells me when someone is really stressed and feeling these kinds of experiences and the results of them at work, there's things happen in the way that they can perform. And I'm not saying it's their fault at all, but I'm saying that I feel like they're being put in a position whereby um, patient care could be impacted.
Yeah. Yeah.
And that is a big flashing lights for me to say it's a good reason why the employer, the regulator, no one should be ignoring this.
Well, and the regulators say that it needs to be not happening.
Yeah.
The organizations say not happening, but I think that there has to be support.
Yeah.
Like it is a challenge if you're providing care to somebody and you
Yeah.
have to provide care to them and they are treating you rudely.
Right.
How do you then provide care in the way that you should, still addressing the rude behavior, but doing it in a way that isn't disparaging of them? Do you know what I mean? So it's a skill development, I think, and it isn't just reading a page on what you should do.
Yeah.
It takes reflection and thinking and practice and what does it look like and why this is important and and not it doesn't mean I'm going back to the shame factor that you are weak
Right.
and don't start believing that you are what this person is telling you, not good enough.
Right. No, agreed. And I think that's the main message here in our podcast is that um, being bullied and your reaction to it or experiencing incivility and your reaction to it is not a sign of weakness. It's
No.
a sign that this is injurious, this is harmful for you, and
Mhm.
you know it, and you wish it wasn't happening.
And
Um,
and I've said this many times about um, soft skills aren't soft. These are considered soft skills.
yes,
They're
yes,
not soft. They're hard. How do you deal with
yeah,
um, a patient, a nurse, a physician, a manager talking to you that way, and it could be both ways. Do you know what I mean? And it it's how, I mean, and also too, because I actually have looked at um, incivility and bullying in business. It happens there too, non-healthcare places. Do you know
It,
what I mean?
Pat, are there differences? Just are
Same
there?
kinds, same kinds. It's a little different in that the people you're dealing with, but there's something about incivility that seems to shut your mouth. Do you know what I mean? That you're told to shut your mouth, but you do shut your mouth.
Right, right. And for
Incivil
whatever
there.
reason you would be, maybe it's just to even protect yourself.
And when you look at it,
Generally protect yourself.
there's many big organizations, even business organizations and World Health and Canadian nurses all have major statements on there should this should not be happening. This is the kind of environment we need, but we need action. I believe in these policies, but how do we make them happen? And I
Yeah.
think in many ways, the big is good, but we also need to look at the down there in the work. What does it look down there? That sounded bad.
Okay. So
That was
again,
civil, what I just said, in the work
it
environment.
does, it brought something to mind, it for me, and I know this again, a little provocative. That those statements remind me of the elevator signs when you go into a
Mm,
hospital, mission and vision elevator signs that say, we're here to provide you with this care and assure you of XYZ. And then in the end, you go in and you may have the worst experience. And I've lived this myself. And you're like, that mission and vision statement, that little piece of paper in the elevator doesn't mean anything because no one's taken the time to actually make sure that the system is running to meet the requirements of that statement. So when a regulator says we don't accept incivility, it's kind of meaningless unless you actually see the action and you see change. Because when
well,
people are just
yeah.
experiencing incivility, they don't feel like the regulator supports them. Doesn't matter what they say or what the regulator says we believe in, unless there's actual action, and which is hard to do, people don't have faith in it. And if you ask me, maybe that's why people keep quiet because they know that, they're just words, but they're kind of meaningless because no one does anything to actually uphold them. And I know it's a little
Well, I think
provocative
they're,
and
yeah,
yeah,
sorry. They are in place and they believe in them for sure. But again, how do you implement it? That's what's really important.
exactly.
And
It's
it's
coming.
the how and what works.
Yeah.
And the in a very realistic, meaningful way. I think that's important because I think too, if somebody says that you're making a negative comment, you can start to internalize that. How do you respond without internalizing, maybe they're right, maybe I am whatever, not good enough, and there's so many ways that people are insulted, right?
No, um, okay, I'm going to spin this around a little bit from the perspective of the person delivering the message, the incivil message. Um, and I'm going to go back to your soft skills. What does that person know about how to be frustrated or convey a message without having to use an insult or any other negative way to get someone to behave the way they want them to behave?
Mhm. They need
Um,
to relearn,
yeah, yeah, yeah.
how to not to and not be personal. And what is the purpose of this comment?
Mm,
You want things better.
yeah.
Well, that's not going to make it better. And so, and also that whole the passive aggressive micro aggression piece is very important because is that really, but it is. Do you know what I mean? Like, oh, you're just being oversensitive. Do you know? So I think that we should all know ways to give feedback or and maybe you just need to keep it in your head. But not act it out in other ways. Do you see what I, you know?
Yes. Okay. So I don't know. For me, from my perspective as a person just living, bullying and harassment, incivility become is a learned experience. You learn how to do it. And you have motivation. Something about it is motivating you to do it.
Mhm.
It's giving
Mhm.
you something back that is satisfying. Um,
Mhm.
and I'm going to go back to your soft skills again. Your comment about soft skills are not soft, or they're hard to learn. Um, it does seem like we need retraining. I'm not here to provide an answer,
No, no.
but it's like maybe that's one place to start is how do we help people retrain
Mhm.
the way they try and convince another person about something they have an opinion on.
Mhm.
Instead of
Mhm.
bullying them into agreeing with them, how do they use other methods to get their
Mhm.
point across?
And I think it's hard to learn, but it's hard to do.
Yeah.
And I have worked with simulation and actors looking at for internationally educated nurses using simulation where they interact in civil situation. However, what has really become clear to me is what are we doing about the person who is in civil? Do you see the emphasis is on the receiver? How do I take this? How do I respond? But what about the person who is sending those messages?
Exactly.
And and not only that, they need to recognize um, the way they're acting,
Mhm.
right? Delivering messages and the verbal and nonverbal, they need to consider it because we don't often think about that. Oh yeah, I'm really interested. Do
Right.
you know? So what, I mean, you can disagree with someone in a respectful way.
Right. Um,
And
so
it's a style of communicate, not a style, it's a way of communicating that you're sending, but if the content is important, if you
yeah,
think someone isn't doing something correctly, how do you provide that information in a respectful way? You
right.
can't,
Right.
right?
Yeah.
Because it's important information. Now, if it's picky, then really, why are you saying it? Because sometimes I think if someone does that kind of behavior, they're insecure themselves and they've experienced this in the past. So they're taken over, do you know?
And it's been effective for them to do it
Yeah.
this. And okay, so we're tapping into that in the moment, or that not system, but sort of social system that is in the workplace. You have the people who experience it and the people who give it, you could say.
Hmm.
And from their perspective,
And the people who
um,
observe it.
and then the people who observe it. Yeah. And any one of those people could be in any one of those positions at any given time.
Yeah.
And maybe that's why it gets normalized because everybody is used to shifting from position to position and it just becomes something they don't really pay attention to the fact that this is something they're not happy with. It's just happening and they've accepted it because they have a job to do and they should just get the job done.
And I
Stuff
think
doesn't
that,
really matter.
yeah, I think the term nurses eat their young came out in like 1980 or something. Okay, that's 45 years ago. Why are we still saying it?
Wow.
Do you know what I mean? I think we need to stop with nurses eating
Yeah.
their young.
Yeah.
Um, and that's the accepted norm. Like
Yeah.
how are we, and the nurses who are being eaten, how do they, but that's hard because you want to fit in also.
You do. And maybe that's another reason why people just push it aside. They want to fit in. And I'm
Hmm.
going to say something that I've observed just as as a Canadian, in other systems, not necessarily the healthcare system, but in other systems where if you are the bully, um, you may be doing it because it gets the job done. And your employer can see it as really effective. You get the
Hmm.
job done, so how you behave is kind of ignored.
Hmm.
Because you
You're
get
a
the job
great
done.
leader.
Yeah, exactly. You're a great leader. So you're actually patted on the back for your methods to get the job done,
Hmm.
which
Hmm.
could include incivility. And then also seeing the victim told, this is how you can accommodate for how you're being treated. Instead of
Hmm.
addressing the bully and saying this
Hmm.
is unacceptable, you have one more strike and you're out.
Hmm.
That's not, I have not seen that happen. Everyone I have
But you
not
see,
seen
the
that
bully,
happen. Yeah,
the
yeah.
bully can get it done without being a bully,
Can I
right?
can I put that in stone?
You want
Pat,
a
everybody
t-shirt?
understand that. Yes, do a t-shirt, exactly. You can get it done without being a bully.
Yeah. And and part of, I'm going to go back to what I said at the beginning is we're talking in this instance about health care. Where is the care? The care should be all around. Do you know what I mean? A caring environment is not, it is for the patient, the client, everyone, the nurses, the other healthcare provider, like everybody,
Right, right.
you know. And I even in the past was assisting a physician who was doing some dressing, and he thought the scissors weren't sharp enough and he threw them at me. I never told anybody, as if I was in charge of sharpening scissors. Um, I didn't get hit. I moved. But like how could that? Yeah, I know. But I never said anything. I just, oh, he's kind of crazy. But that's not acceptable. I never said anything to, I didn't even say, don't throw the scissors at me. Now today I would say, don't throw the scissors at me. That is not acceptable.
Right.
You know? And I can say it kindly without saying you're a jerk. Do you see what I mean?
Yes. So standing up for the protection of yourself,
Yeah.
of
Yeah.
of your physical body, because a pair of scissors could actually do you harm
Mhm.
and cause a wound, and the protection of yourself as a person, uh,
Yeah.
and your mind, and your heart and your mind.
Yeah. And not only that, anybody else who is observing is also saying, I better be careful in the future. Do you know what I mean? So it's so widespread. That's why it's not one focus. It is so, and what about the patient lying in bed? Do you know what I mean? Like the
Watching.
environment is big, right?
So they're observing a non-caring environment, and they could be
Yeah.
wondering what's going to
Yeah.
be me if I
Yeah.
make this doctor frustrated.
Mm-hmm.
And
Mm-hmm.
so it doesn't do anyone any good.
Mm-hmm.
But someone somewhere has said, but it does, and we're okay keeping
Mm-hmm.
it going.
Mm-hmm. And
Uh,
I think it's hard for and I go keep going back to this a bit, but this is a longer conversation. The whole patient piece, the client piece. If the client or the patient is not accepting, rude, disrespectful, that's really a challenge in healthcare, how you approach that.
yeah,
Do you know what I mean? And
yeah.
still provide care and don't ignore them and, you know,
Pat, we're going to have another podcast, and we're going to cover that topic.
because it is really hard.
Yeah,
Um, and I'll just give you a hint of coming up. I have said to nursing students, how many of you think you will like every patient you look after?
yeah.
Okay. They all put up their hands. And
Right.
then I say, how many of you know people you don't like?
Yeah.
They all put up their hands. And here's my magic sentence. Do they get sick? So you
Wow.
have to figure out, do you know what I mean? I'm not saying you accept a patient talking to you, but how do you deal with it and not influence the way you see them? That's another kind of skill.
Okay. Oh, this is blowing my mind. So, okay. So we're coming to the end of our podcast, Pat. So I'm going to ask you my final question here, sort of as a takeaway for everyone listening. Um, what can people do when they find themselves in a situation of incivility besides quitting? And I mean, and again, can you recap a little bit of what the system can do to start to ensure that this starts to stop?
Hmm.
And
Yeah, I think policies are in place, but I think there needs to be um, resources, support for how to implement what to do if you face this. I think and it has to be practical because it isn't just reading a page. I think it really practice what you can do. Um, and I think that, but it makes me sad that people who are listening to this podcast probably have experienced something like this, right? But or you've done it yourself. You've been in civil, I mean, it's possible because sometimes you think, ooh, that came out of my mouth, right? But I think the
Remember when
invitation,
you've done it. Remember when you've done it yourself.
yeah, yeah, you know, so think about it, and not just think, but reflect. What happened at the time? What does it mean? As the bully or the receiving of the bullying, what could you have done in the past, done at that time? And most importantly, what will you do in the future? Because change really is thinking new, not to dwell on the past.
Mhm.
It is important because it influences us, but what new are you going to do and change? Because it's important. And it's about changing one at a time, right? And hopefully then that sort of spreads out, right?
So this is a self-reflection. This is like
Yeah.
stopping yourself and saying, let's, I need to think about what just happened here and how I acted or how I reacted, depending on
Yeah.
the situation you're in. And not just walking away from it and ignoring it and compartmentalizing it away from you.
Hmm.
Actually, and and that may be as hard or as easy per individual. And people may need support or assistance in order to do
Yes.
that
Yeah.
too.
Yeah, and reflecting beyond, that's really important. But I do think that it helps to have have some ideas on what you can say in the future. Do you know what I mean? In a respectful way, both of you and the observer. So three could be more than one observer. Do you know what I mean? So what does that look like?
Yeah. Like even as an observer, I don't know how many times my kids were taught, if you see a bully in the schoolyard, step in and say, that's wrong. You shouldn't be doing that. Or go and tell a trusted adult. And that instruction still holds as adults,
Yeah, yeah.
right?
And there's a way even to as the receiver or as the observer to respond in a way that actually might educate the person who is bullying. I don't know.
Yes.
I don't know. But I
Yeah.
mean, I think that it has to be zero tolerance for that kind of behavior, because it has a major influence on patients, on healthcare workers, on nurses, on the organization. It has an impact. And if we've been still talking about this all these years, it's time to stop. Well, no, not to stop talking,
Yeah.
but stop it from happening
Stop it. Okay.
through real um, tools to
Right.
deal with it.
Right. Right. So with that, Pat, thank you for your time today, talking
Thank
to
you.
everyone about this really, I don't even want to say important because that word doesn't even do it justice. This critical, critical topic area of being able to talk about incivility and trying to figure out how we change what
Mhm.
people are
It's
experiencing.
uncomfortable. It's uncomfortable. Even, Tanya, I told you coming into this um, podcast here, I was thinking, oh, how's it going to go? I'm worried. Listen to me in my head. Um, I hope it goes well. I don't want to be hurtful. You know what I mean? So it's very complicated. It isn't like um, uh, how to insert an IV. Do you know what I mean? Inserting an IV has a complication, but this is more of a complicated piece and discomfort.
Yeah.
And even when I did the simulations with the internationally educated nurses, I worried and worry before each one because I want it to be okay. So there's something sensitive to this, it feels raw, but
It
it's
is.
important that we rip off the Band-Aid and we address the wound. Ooh,
Right.
that's very
Oh, I
poetic.
like that. Okay. That is a good image right there. So thank you again, Pat. Until
Thank
we
you.
talk again on our next podcast about the topic of incivility, taking it over to the side of the patient, the interaction between the
Right.
patient.
Perfect. Thank you. Have a good day, everybody.
You too, Pat.
Bye.
Bye-bye.
Thanks everyone for joining our podcast today. Please remember to like, subscribe, and share. Look below in the description and you'll see links to our blog. Check them out on our website, the Canadian Healthcare Education Network. See you next time in the next podcast.